Welcome back, everyone, and welcome to the last content session of today's Engaging Long-Term Care Summit. It's my pleasure to be able to introduce FCO's very own Kathleen Edwards, who is going to be presenting Powers of a Family Council, Fact or Fiction. You probably know Kathleen from a variety of our other programs and events. She's been with FCO since January 2020, nothing like starting a new job at the beginning of a pandemic, but very quickly started and continues to produce some really fantastic education for councils, long-term care team members, and our sector partners. She's had experience in community supports, working with people with disabilities and academia, and brings her wealth of knowledge to the FCO team. So Kathleen, take it away. Powers of a Family Council, Fact or Fiction.
Thank you so much, Sam. And I will apologize for the wealth of legislation we're going to talk through today. I promise if you bear with me, we will have an interactive component at the end. So please make sure you are paying attention because it will shape how you feel when it comes to the end of the session, when I actually am going to ask you to identify if the situation is actually fact, which means that, yes, it is something that's in line with what is written in the Act when it comes to the powers of a family council, or if it's fiction. So what we're going to do today is we're going to understand the Fixing Long-Term Care Act and what it says about family councils. We're going to review the powers of a family council as outlined in the legislation, and we're going to decide whether certain scenarios are fact or fiction based on the legislation and supporting regulations. So what is the Fixing Long-Term Care Act? So the Fixing Long-Term Care Act came into effect April 11th, 2022, and replaced the Ontario Long-Term Care Homes Act of 2007. The new act includes recommendations generated after 2 years of increased attention on the sector, public consultation with residents, with families, staff, and recommendations from the various reports that were published in light of COVID-19. This includes the Ontario Patient Ombudsman and Long-Term Care COVID-19 Commission reports. One of the top requests for support from councils and from staff is to understand this legislation and how it informs the power of family councils. So it's really exciting to see that family councils are part of this act. And the preamble for the Fixing Long-Term Care Act states that the people of Ontario and their government acknowledge that residents' health and quality of life depend on integration and collaboration between an ecosystem of people, including fellow residents, family members, caregivers, long-term care home staff, volunteers, service providers, community, and government. It also recognizes the importance of caregivers in supporting a resident's physical, mental, social, and emotional well-being and quality of life. So this is written in the opening statement or preamble of this piece of legislation. So what does the Act say about family councils? The role of family councils as partners in care remains evident in the updated legislation governing long-term care in Ontario. Family councils were first included in the Long-Term Care Homes Act 2007 after many, many years of advocacy and of sharing of the role that families play and the need for families and friends and persons of importance to engage in support and collaboration to try and advocate for the best quality of life for residents. So family councils were first included in the Ontario Long-Term Care Homes Act in 2007. And again, it marked their contribution they make both in long-term care and as a partner in the long-term care sector. The Fixing Long-Term Care Act provides homes with additional guidance to ensure the voice of family councils is present and is heard as part of the quality improvement committees. It also states that every long-term care home may have a family council, but that doesn't mean that every home will have a family council. It also states that if there is currently no active family council within that long-term care home community, a family member of a resident or a person of importance to a resident may request the establishment of a family council for that long-term care home. And upon notifying the licensee that they want to form a family council, the licensee shall assist the establishment of a family council within 30 days of receiving a request from a person mentioned above, or someone who is eligible to be a member of that family council. When it comes to membership, council membership is one of the aspects outlined in the first Long-Term Care Homes Act and continues to be an important element of the new Fixing Long-Term Care Act. Sections 59, subsection 5 and 6 speak to the guidance of who can and cannot be a member in the council. So again, right to be a member or rights of membership. A family member of a resident or persons of importance to a resident is entitled to become a member of the long-term care of the family council for that long-term care home. Accordingly, all family members, friends, or persons of importance to a resident have the right to be a member, and all members have a vote when it comes to making decisions. This means that estranged siblings who both have a relationship with a parent living in long-term care home, a common law partner, a neighbor of a resident who's a lifelong friend, are all eligible for membership and covered under the section about who has a right to be a member. Councils are more than just essential family caregivers and designated care partners. So membership is more than just the person who is that substitute decision maker or power of attorney, the person who is in there providing care. Anyone who is covered under the subsection of the Act is eligible for membership, and they've outlined a few examples for you. All members have a vote when it comes to making decisions, and unfortunately, this is a point of contention, especially when it comes to continued membership within family councils. And again, when it comes to being rights to be a member, I'll speak to in a few slides. But we'll also, membership is connected to something called continued membership, and I'll speak to that in a few slides. And then again, family councils as a collective should decide and articulate what membership entails in relation to things such as participation in family council meetings, as well as in voting and other aspects of what their council does. So some examples of who can or who is eligible and who is ineligible or who cannot join family councils. So the following are examples of people who can join a family council: a spouse or common law partner, children and stepchildren of a resident, grandchildren and great-grandchildren of residents, friends or lifelong neighbors are all eligible to be members of family council. The following are not eligible to join a family council: the home licensee, anyone who is a member of the home management or leadership of the home, any person who is a member for the board of directors, if it's a not-for-profit organization or if it's a for-profit corporation, they are ineligible for membership if they sit on the board for that corporation. The home administrator is not eligible to be a member of the family council, nor are staff members who are working in the home, and that includes the council assistant, but as well any frontline staff or staff who want to get involved and join the council. They are not eligible to join. And then anyone who is an employee of the Ministry of Long-Term Care is ineligible to join. Continued membership. So again, as I mentioned, every council is unique and determines their own rules, and responsibilities when it comes to continued membership and membership requirements consistent with the Fixing Long-Term Care Act. Councils can individually determine the appropriateness of continued membership of a participant and participation of a council member after the death or transfer of a resident, as long as there is no conflict with the requirements for membership as outlined in the Fixing Long-Term Care Act. As such, the council can set provisions within its terms of reference for continued membership in a family council for someone whose person is no longer living in the home, whether they're transferred to another long-term care home and they still want to be a part of that family council because they're very passionate and connected to the council, or whether their person has passed away and they're no longer a resident in that long-term care home. That family member or person of importance may still, if they were part of the council before the death of that person, may still want to remain part of the council. It's important for councils to have a terms of reference that defines its structure, operating procedures, and membership. And when you mention membership, you're going to want to outline and provide a description of what would be involved in continued membership. So what are the expectations for participation, for voting? Is there a limit or a set duration for how long someone could be part of that council after someone has passed away? The licensee does not have the authority to interfere with the decisions that are made when it comes to membership in a council or continued membership. So again, the home staff cannot make decisions about what happens to someone after the person has passed away. That is up to the council itself and should be something that is stated within your council's terms of reference. So what exactly are the powers of a family council? So within the Fixing Long-Term Care Act, Section 66, subsection 1(1) says that councils can provide assistance, information, and advice to residents, family members of residents, and persons of importance to residents, including when new residents are admitted to the home. So again, it's really important for family council members to be aware of the role that you're playing as a member of the family council, as well as in your long-term care home communities. So when you are there in your role as a family friend of a resident, that is your role. Even if you're a trained medical professional, the home community is not within your current scope of practice. It's not where you are working, because if you worked in the home, you wouldn't be eligible to be a member of that family council. You can share information about resources that you've come across that have been helpful to answering questions. You can provide ideas and support brainstorming of solutions to issues that another person shares with you. However, you cannot and should not undermine what the staff have shared, as they are the experts with the knowledge, skills, and abilities to make decisions in the home, especially when it comes to the care plans for residents. So even if you are a trained medical professional in another atmosphere or realm, because you were there in the capacity of a family or friend of a person living in that long-term care home, you can share resources, but you cannot provide your professional insight as a nurse or as a doctor, because you are not privy to all the information that someone who is in that role as a professional in the home would have. So therefore, you can't make a decision because you don't have all the information you need. Your role there is specifically that of a family or friend, and therefore you can support them, you can help them brainstorm, but you cannot contradict what medical professionals have said because you do not have access to all that information. Family councils can also advise residents, family members, and of residents and persons of importance about their rights under and obligations under the Act. So for family councils, what this means is that when you raise a concern or a shared issue that's brought to the attention to staff, you need to recognize that when you do share that, they have 10 days to acknowledge your request, and they have 10 days to acknowledge in writing and respond to it, just to acknowledge that they've got it, not necessarily say that the issue's resolved, but they have 10 days to say, thank you for sharing your concern with me, and then letting you know what the next steps would be. Doesn't mean they'll have the answer, but they might have some ideas of the next steps in the process, how long it might take them to get back to you. What this also means is that a big thing that councils do is they provide support. And so what the first two statements say is that when translated into plain English, it means to emphasize the role of a family council is a source of providing peer support. It's a place where family and friends of residents can go to share their specific experiences and discuss solutions to individual problems. if it's part of like a general sharing period where you open up your meeting, just checking in with each other, you let people just speak about what they need to speak about and get support in an environment that's structured with other people who are in a similar situation to them. So again, you can provide advice similar to what you would do when you're going for coffee with a friend. They ask for your input on a relationship, and based on your experience, you kind of give them an answer to what their question has been. This is a similar thing that councils can do. So you can, have an informal conversation over tea, over coffee, and just like you would with a friend, give some ideas about, what have you done? What have you heard? Acknowledge that, they're not alone in experiencing that thought or emotion or that struggle. Remember, it's based on your personal values rather than your professional code of ethics. So again, you are there and you can follow your own personal values, but again, you're not bound by your professional values at that point in time because you're not there as a professional, you're there as a person, again, who is connected to a resident in that long-term care home and who in turn is in need of potentially some form of peer support and a place where you can share your experiences and just be around others who are going through a similar situation to you. Another power of the family councils written in the Act is that they can attempt to resolve disputes between the licensee and residents. So what this means is that the family council and a family council meeting is a forum for conversations. It's a place where you can have a town hall where families can ask questions and staff can share details about decisions that have been made about certain issues or things happening within the home. And then I will also say that Family Councils Ontario does offer specific support and programs when it comes to conflict resolution. There's also e-learning available to help you develop skills that you could use to help engage in problem solving and conflict resolution. So if something comes up between the residents' councils and members of the resident council, and they come to you seeking support, the family council can try to provide them with support in resolving that dispute. If there are two members of the council that have a disagreement, the council is a forum where people can work through that disagreement. And again, you can engage in some conflict resolution. Family councils, these are probably the most popular things that councils do. They can sponsor and plan events for residents. They can also engage in collaboration with community groups and volunteers concerning residents for activities. So sometimes you can notice something going on in the home where you'd like to see things improved or changed. Good example is laundry. So you've mentioned, oh, the laundry goes missing. One of the common things that family councils can choose to do is to have a lost and found laundry day where families can, there's tables put out, the council organizes that there'll be people manning the table, and families can put out laundry that has mistakenly found its way to their room and it doesn't belong to their family member, so they can put it out and hopefully help connect that pair of socks or that robe or whatever piece of laundry it is back to its rightful owner. So councils often take on that as an event that they want to plan and sponsor. So once a month, they'll have the table set up, they'll have people manning the tables, and they'll make sure that everyone's laundry goes back to where it should go. Another thing that they can do is they can, for the benefit of residents, sponsor entertainment that they want to see brought into the home. Councils can also organize events to help improve quality of life within the long-term care home. And again, councils often find that they really appreciate using meeting space as an opportunity for education. And so when there's a topic where people have indicated their interest in wanting to learn a little bit more, dementia is a good example, de-prescribing is another good example, fall prevention, then the council can reach out to community organizations and find a guest speaker who will come in and host a special lecture or special lunch and learn series or whenever you decide to do it focused on that specific topic of interest. Family councils do have the right to review inspection summaries, written plans to achieve compliance based on what was found within that inspection, a detailed allocation of funding for the home, as well as financial statements relating to the home filed with the director, as well as information about the operation of the home. So it's important to remember the term review. Review means that you have a careful examination of something. or you'd formulate a judgment of the quality of something. So it's a way for councils to explore information that exists, but you don't want to do it in a way where you're going to seek out inconsistencies and use it as a means to engage in arguments with the home. You don't want to use those powers in a way that creates a sense that you are out to get someone or that you're going to combat someone. What you want to do is you want to engage in collaboration. You want to, if there's going to be a new policy that's going to be rolled out in the home, you can work with the manager to be a set of eyes where you could go over a draft of a policy and provide feedback with that policy before it's rolled out in the home. You really want to identify the good as well as the bad within something. So again, it's not meant to be malicious. It's really meant to be a tool that provides opportunities for collaboration between homes and between councils. And another example of how that collaboration can happen is in the mission statement of the home. So the mission statement for the home should be created in collaboration with the residents and families councils. And in the act, it states that the licensee shall ensure that the mission statement is developed and revised as necessary in collaboration with the residents council and family council, if there is any, and shall invite the staff of the long-term care home and volunteers to participate. So when it comes to the mission statement for the home, and very often in the home, the mission statement is something that's very visible within the home. Often it's posted, maybe framed at reception or near the front doors. It's something that is posted on the website. It's something that's posted in the newsletters and any form of communication that goes out from the home. And so ideally that mission statement is created in collaboration with all of the stakeholders for that long-term care home community. And it is something that is updated at least once every 5 years. So it's not something that stays fixed once it's written, it stays there because things change and what happens in the home changes, the needs of that community changes. So the mission statement is a good example of a policy where the home can engage in collaboration with the council to get their feedback on some of the language or some of the things that should be added. And again, the licensee consults with the residents and family councils if any revisions are required for the mission statement of the home. Again, continuous quality improvement. So this is another good example of ways that the home can collaborate with the family council and the powers of a family council. So every long-term care home is expected to implement a continuous quality improvement initiative as provided for in the regulations. A licensee shall make every reasonable effort to act on the results of the surveys to improve long-term care home and the care services, programs, and goods accordingly. So every licensee of the home needs to, at least once a year, do a survey of residents and families and caregivers of residents to measure their experiences in the home and the care services and goods and programs provided for in the home. And the licensee shall seek the advice of the residents council and family council, if any, in carrying out the survey and acting on its results. So in creating the survey and deciding how it's going to be conducted, how they're going to report the results, they should be consulting with the council when it comes to what's the best way to get the questions out, how long should it be, what's the best format, hard copy, digitally, and then again, what is the best way now that we've learned what we've learned, share what they've learned with the family council. What's the next step? What should we do now that we've learned what families appreciate, what they want to see changed? The licensee also does need to make sure that the results of the survey are documented and made available to the residents and family council, and that the actions taken to improve long-term care their long-term care home are based on the results of the survey. Again, family councils have the right to advise the licensee of any concerns or recommendations the council has about the operation of the home. So again, in that council, it's really that context to identify shared issues. So an issue that is not just something that happens to one family member or one resident, but really it's an issue that happens to a number of residents and impacts a number of residents or a number of family members. So once you've identified that shared issue, councils have the right to advise the licensee of the concerns or recommendations they have about the operation of the home. They also have the right to report to the director any concerns or recommendations that they have that ought to be brought to the director's attention as opposed to the home licensee's attention. So basically anything that councils identify as that shared issue, they have the right to bring forward to the appropriate person. When it comes to the role of the home, what is their responsibility? So the first is their duty to respond. If the family council has advised the licensee of any concerns or recommendations, the licensee shall, within 10 days of receiving the advice, respond to the family council in writing. So this response doesn't need to be detailed or the answer to the concern. However, depending on the issue raised, it might be. So if it's a very simple, straightforward answer, then within 10 days, you may get the response. However, if it's a very complex, multifaceted issue, then you may not get an answer within those 10 days. In most cases, it will be a message that acknowledges the concern has been received and may provide details about when to anticipate a more detailed response. Many councils will often use some form of tracker to track the issues that they've raised, as well as the timeline for when those issues are resolved, and to take note of any progress on those issues. And I do want to say Family Councils Ontario does have a template for an issues log that you can keep. And one of the reasons why it's helpful to have this is, again, and so the previous session, Bambo and Adriana mentioned transition and turnover. So again, depending on the issue and how complex it is, it might take quite a long time for those changes to be implemented. And if there's a huge transition in membership in councils, you might lose track of how long the issue's been going on. So an issues log or an issue tracker, which we have a template at Family Councils Ontario, is a great way for you to provide the continuity in your council. Even though membership may change, you can still keep track of the issue and log the duration of where are you at with that issue, what are the next steps to be taken. When it comes to the family council assistant, so this is also referred to or also known as a staff assistant. So it's a member of the staff that supports the work of the council. It's often a member of the recreation team, the volunteer coordinator, social worker in the home, or someone who has a strong working relationship with family members. So if the council requests, the licensee shall appoint a family council assistant, also known as the staff assistant, who is acceptable to the council to assist the family council. Again, their role is primarily to provide support to the council. So in carrying out their duties as a council assistant, they shall take instructions from the council to ensure confidentiality where requested and report to the council. So again, there'll be someone who has the skills needed to manage different group dynamics, specifically the skills that might be helpful in leading conflict resolution internally to the council, but also someone who understands why councils matter, as well as the experiences of families and friends of residents in the home. So someone who's aware of the issues that are going on in the home, someone who can engage in collaboration, is comfortable working with families. And again, it's someone who's acceptable to the council and who will take those instructions from the council. What is the role of the licensee? So again, when a council requests information to help them enact the powers outlined earlier, the licensee needs to share it with them. So any request that's made under the powers of the family council to review certain documentation to form a council, the licensee does need to support councils in working with their requests if it's in line with what's outlined in the Fixing Long-Term Care Act. So again, cooperation and with an assisting council. So the licensee shall cooperate with the residence council, family council, the resident council, and family council's assistants, and shall provide them with such financial and other information, such as assistance in providing, as is provided for in the regulations. So if you request to review the publicly posted financial statement for the audit last year for the long-term care home. If the council requests to have a copy of that, then they have a right to get a copy of that to promote discussion. Duty to meet with councils. So again, if the licensee is invited to meet with a family council, then they are required to meet with that council. And then attending meetings. The licensee shall attend a meeting of a resident or family council only if invited, and shall ensure that the staff and other persons involved in the management or operation of the home attend the meeting if invited. So it is up to the licensee of the home to make sure that the administrator or any other manager who's part of the staff, if they are invited and requested to present at a family council meeting, are available to support the family council and attend and present at that family council. So again, this is where the importance of having a relationship with all different people involved in the home, including the administrator or the licensee, is helpful. Because you can have a discussion about the preferred format for communication, as well as how they would like requests to be made. So do they want you to set a meeting up with them and share your requests for having people attend and present information in person when you're having that conversation? Or are they comfortable with having an email conversation about those specific requests? So that's where having that relationship between the council leadership and the home licensee and the administrator are key. So you have an understanding of preferred methods for communication. So how these requests can be made and the specific format that these requests should be made and can't be made in. Something that's important to be aware of is what no interference means. So we've heard the term interference in sports, specifically like hockey or football, where it means that one player, so the player that is defending, interferes with the player who's trying to score a goal and prevents them from achieving what they're trying to achieve. Family councils are self-led, self-determining groups. So interference is the act of getting involved in and trying to influence situations that should not involve you, or in ways that impact another person or another group. So interference, when it happens to a family council, means that someone who should not be playing a role in shifting how that organization works or how that group works is trying to tell them what they should or shouldn't do. And they don't have the right to exert those expectations or control. So the licensee shall not interfere with the meetings or the operation of the residence or family council. So the licensee has no say in how a family council operates, how meetings happen, virtually or in person, the duration, the frequency, what they decide to do during those meetings. It's not their business, because that is the business of the council that would be determined in their terms of reference. The licensee shall not prevent a member of the residence council or family council from entering the home to attend a meeting of the council or perform any functions as a member of the council, and shall not otherwise hinder, obstruct, or interfere with such a member carrying out those functions. So again, now COVID is the exception, which there were restrictions. However, again, the licensee does not have the right to prevent someone, if they're coming in for a family council meeting, to participate in that family council meeting. And then the licensee shall not prevent a council assistant from entering the home to carry out their duties, or otherwise hinder or interfere with such assistants in carrying out those duties. So that means that the home cannot interfere with the council assistant and their intent to do work on behalf of the family council. If they've been asked to do something by the council, then the home cannot step in and tell them that they cannot complete that request, because the request is made to them. Council assistants are required to listen to what the councils are asking them to do. Another important thing to be aware of is immunity, specifically of council members and assistants. So sometimes some people might feel uncomfortable sharing their concern or issue, or taking on a role where they're going to bring an issue to the attention of the home, because they're worried about the repercussions of what would happen to their person. And so the Act actually says that they do have immunity, both of the council assistants and of council members. So no action or other proceeding shall be commenced against a member of a residence council or family council or council assistant for anything done or omitted to be done in good faith in the capacity as a member or as an assistant. So all this means, in plain English, is that the council assistant, if they are doing work on behalf of the family council, they don't have to worry about consequences that would impact their future as an employee or their role or their performance evaluation, because they're supposed to be immune from that when it comes to the act. They can't be penalized when they're doing things they have been asked to do on behalf of the family council, because the act asks them to do things on behalf of the council as directed by the council. Same goes for membership. So for family councils, if you want to raise a collective issue, then there can't be any consequences against any member of the council because they have decided to raise the specific issue. So again, you have, based on the powers of the act, when you're acting within what has been outlined in the act also outlines that you do have immunity, which means that you personally or your person cannot be impacted because of the work that you're trying to do when you're part of a family council or when you're a council assistant supporting a family council. So now we're going to get into a little bit more of an interactive situation. So we're going to play a game, and what's going to happen is I'm going to bring up some polls. If the polls aren't showing up, then I will just say type in a fact or fiction in the chat. And so what I'm going to do is we're going to apply what we've talked about when it comes to the legislation and the powers of a family council. And you're either going to vote if you believe the statement is fact, which means that it's something that is within the powers of the family council or of the council assistant, or fiction, which is not within the powers. And I will say all of these situations are things that we hear quite frequently at Family Councils Ontario. So these are not fictional situations. Scenario number 1, your council wants to be able to communicate with each other better in between meetings. As a group, you decide to use a council Gmail account and create a Facebook group with specific guidelines for participation. The home administrator hears about your council's plans for communication and has asked you to close the Facebook group and will refuse to respond to the chair when they communicate using the council's Gmail account. You feel this is not allowed and the administrator is overstepping. So is it fact that the administrator is overstepping, or is it fiction that the administrator is overstepping? And I'm just going to see if I can bring up people. Lunch. Right. You should see a poll popping up. And if you can, vote on scenario number 1. Is it fact or is it fiction? Wonderful. I'm seeing responses going in. Alrighty. So it is fact. So this is considered to be interference. The administrator cannot make any decision on behalf of the council, which includes how you choose to connect with each other or how you would choose to communicate with the home. So if it's something that you as a group, as a council, have collectively decided you would like to see happen, that is not in their power to overstep the decisions. They cannot make decisions on behalf of the council. Great work. So we're going to move on to our next scenario. Scenario number 2. There's a newly hired recreation manager in your rural long-term care home who will be taking on the role of council assistant to the family council. They've heard about the different ways that councils operate and are surprised to learn that the previous council assistant was the one who organized and led all of the meetings of the council. When you ask long-time members of the council if the council assistant can lead the family council, they say that's how things should work, and it's in line with the Fixing Long-Term Care Act and what it states. Your council is ready to support the new recreation manager and welcome them as the chair of your family council. So is it fact that the council chair can be the recreation manager, or is it fiction? So you can vote for poll number 2. I'm just going to bring up the poll again. So it'd be number 2. Scenario number 2, hopefully it pops up the next question. And is it fact or fiction? So can the council chair be the recreation manager? Is it fact that a recreation manager can be the chair of a family council, or is it fiction? So it should be scenario number 2, and you can either choose fact or fiction. Oh, it's not showing? Okay. All right. I'll end the poll then. And then just type in the chat if you think it's fact or fiction. I'm seeing fiction, 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 fiction. Yes, it might do that. Fiction. I'm seeing everyone is hitting fiction. Wonderful. Fiction, fiction, fiction. Well, overwhelmingly fiction. Yes, absolutely. It is fiction. So the staff assistants are meant to take direction from the council. Their role is to create opportunities for members to learn skills and to help them take control and ownership over the council. Hopefully the council assistant is aware of all the great resources that Family Councils Ontario has to offer and help point members to those resources that are available. One of those resources is an e-learning course that teaches someone the skills that they would need to be able to take on the role of facilitating or chairing or leading a council meeting. They can also attend Family Council Ontario events to help them feel more comfortable in developing the role in supporting councils, but also encourage council members to take advantage of Family Council Ontario events so they can develop skills and network and get more comfortable and taking more control over the council. So again, yes, it is absolutely fiction. Great job, everyone. Next one, scenario number 3. Sorry, your council decided to create a new standing item on the agenda to discuss aspects of the Fixing Long-Term Care Act with the administrator. This month, you're exploring resident councils and family councils. The administrator believes they serve the same purpose and should hold joint meetings with residents and family friends, playing an active role in facilitating meetings and participating in discussions. Are resident council and family councils the same thing in Ontario? Is it fact that they're the same thing, or is it fiction that they're the same thing? Wow, very quick responses. Absolutely, it is fiction. I'm going to say this in the sense that if you're joining us and you are not in Ontario, I'm not too sure what it is because, again, legislation for long-term care is a provincially governed thing. And I can speak to the fact that in certain other jurisdictions or provinces in Canada, that residents and family councils are and can be the same thing. However, under our legislation in Ontario, the Fixing Long-Term Care Act, no, they are not the same thing. They are separate entities. Doesn't mean that they cannot have a joint meeting. But again, if they had a joint meeting, they'd still hopefully have their own meeting minutes to record what was discussed and work collaboratively just to make sure that, you know, the family council brings kind of their shared understanding of how meetings have worked when it's just a family council meeting, bring that insight and bring their terms of reference to the table when they're meeting with the residents council leadership to try and plan that joint meeting. So you can have a joint meeting. You'd want to have your own separate minutes. And if you are in Ontario, family councils and resident councils are not the same thing. Scenario number 4. Your family council will be holding an election next month. During the most recent meeting of the nomination committee, there's debate about the eligibility to vote. The argument is about who gets to vote and the number of votes per family. You believe that each family member, regardless of the extent of their previous participation in the council, gets a vote in an election if they show up the day of the election. Is it fact that yes, every person that shows up gets a vote, or is it fiction? I will say this one of all the scenarios so far is a little bit trickier, but seeing the results, the bulk of you, 80% of you say that it is fact, and about 24% of you say it's fiction. 76 to 24% say it's fiction. You said it is fact. Yes, you are correct. It is fact. So as it's written, all family, friends, and persons of importance of a resident are eligible to vote and get a vote in an election. Councils can provide additional guidance on how this works in their terms of reference. So again, very generally, yes, it is fact. Anyone who is eligible for being a member, if they show up the day of the election, and depending on how you're having your election, if it's an in-person vote, if they're there for that meeting, they're eligible to be a member, every person gets a vote. However, this is where your terms of reference comes into play because it can outline a bit more about expectations for votes tied to membership, tied to participation in prior council meetings in advance of the election. However, elections are also a great opportunity for councils to grow and to recruit new members. So when it comes to trying to recruit people, if your council's out there and you're saying, hey, come join our council, and the response you get from potential members is they'd be interested, but they've heard that they really don't like someone who's leading the council. They don't like how negative things are. You can reach out to those people and say, we're having an election. There's going to be an opportunity for things to change. If you want to see things change because you weren't happy with how things were going, then come out and vote and then join our council. So it is fact. And again, it's a really good way to try and take what you learned from people when you're trying to recruit members. If they aren't happy with how things are, and you know there's a chance for people to have a say in making changes in your council, then it's a great way to take those people who said, I'd be interested, I just don't like how things are, and invite them to join your council and to come and vote and to remain an active part of your council after the election happens. Scenario number 5. During a recent meeting with the home administrator, you as the chair have requested to receive a copy of the home's financial reports. You want to discuss this information during your next council meeting. The administrator does not believe that you have the right to request this information and refuses to share it with you. So is it fact that you can request a copy of the home's financial reports, or is it fiction? So that'd be scenario number 5. You as the chair are meeting with the administrator and you request a copy of the home's financial report. So is it fact that yes, you can request this report, or is it fiction that no, you do not have a right to request that report? Great work. So I'm seeing that most of you, 85% of you, 86% of you think that it's fact, and 14% of you think it's fiction. So in this situation, based on the legislation, it is fact. This is one of the many powers that a family council has as outlined in the Fixing Long-Term Care Act. So they've made this request in advance of when they want it. They're not showing up the day of and expecting it to be ready. They're requesting it during a meeting with the home administrator. So it is within the powers of a family council to request the ability to review that specific piece of information. You're doing a great job with all of these different questions and scenarios. So we're going to talk about scenario number 6 now. Your home has a large, highly active and engaged family council. You have a strong relationship with many managers in the home, however, experiencing some frustration with the administrator. They're new to your home and were highly involved in leading the council in their last home. You've invited them to attend the council meeting to introduce themselves. However, they insist that once they're done introducing themselves, they can sit in the room and listen to the discussion. So is it fact that once they're done introducing themselves, they can stay in the council meeting and listen to what you're going to be saying in the rest of the council meeting? Or is it fiction that they can stay in the room once they've introduced themselves and answered any questions? So scenario number 6, is it fact that they can remain in the room once they've introduced themselves, or is it fiction that they need to leave? Alrighty, so it's looking like most of you, 68%, say that it is fiction. Absolutely, it is fiction. So administrators or guests of the council are not eligible to attend or participate in the whole council meeting. They can attend only if they are invited by the council. Hopefully, the council will share a copy of the agenda with the people that they're inviting so they can get an idea of what's expected of them, i.e. like where in the agenda are they showing up. And if you share the copy of the agenda with them, they might get an idea that there's other things you're going to be talking about. Therefore, they aren't required to sit in and listen to the rest of the discussion because it's not appropriate for them. But yeah, within the act, they're allowed to attend only if invited, and they're allowed to participate for the duration that is required and requested. So it's really helpful for whoever would be inviting the administrator to attend the council meeting to explain what's expected of them, to say you're going to be coming and introducing yourself so we can get to know you and ask you any questions. We're guessing that it would probably take no more than 15 minutes of your time. After that time, because we're going to be talking about some other council business that isn't important to you, we're going to ask that you leave the room and that we can resume our council meeting. Another good way of handling the situation for the council might be to have them speak just before you have a bit of a break in your council meeting. So you have a break, so there's just a natural pause. Everyone can get up and go to the bathroom, leave the room, get a snack, whatever it is. But then if they are still sitting there like they're ready to continue to participate in the council meeting, you can go up and kindly and gently remind them, hey, we love that you're excited about the council, but really we don't need you here beyond what we asked you to come here for. So we know you're busy. We appreciate you're busy. Can you please, leave the room, go back to your office and resume your work so we can continue on with the meeting. Scenario number 7. So the current chair of your council is amazing. Under their leadership, you have a vibrant council with many active members. This week, the chair's parent died suddenly. The administrator is aware of the death, and within a week of the death, informs the chair via email they are no longer able to serve in their role. They appoint someone else to the role as chair. The council has a terms of reference with a specific date for an election in the next 4 months. Can the administrator appoint the family council chair? Is it fact they can appoint the chair, or is it fiction they can appoint the chair? Well done. So overwhelmingly, I'm seeing a 100% response to fiction. Yes, it is absolutely fiction. So that would be an example of interference. The home administrator cannot make decisions on behalf of the council, and that include who would be the chair of that council. It's also an example of continued membership. So just because someone's person has passed away doesn't mean that they're automatically kicked out of the council. Within the council's terms of reference, in this example, it says that they have an election planned in the next 4 months. So that council has agreed that regardless of what happens, if someone should pass away within that year of them being in that specific role, they would still stay on in their role, and then at the next election decide what they want to do, and the council can have a say in what happens. So at least for the next 4 months, they're in the role of chair. They can decide if they would like to step down but still be a part of the council, or they could decide that they are just done with the council at the end of that 4 months. But because of the legislation and what's stated for continued membership, just because someone has passed away does not mean that they cannot be a part of the council. The council has the terms of reference that provides guidance when it comes to the election and when there'd be a transition in leadership. So at least for the next 4 months, that person would be the chair of the council, and they have time to decide what would happen, and the council has time to have a discussion with what would happen when it comes to continued membership for that individual. Great work, everybody. They're starting to get a little bit more and more complicated. All right, scenario number 8. Your home was recently acquired by a new chain, which means there were many changes and updates in the policies and procedures of the home. As the chair, you've invited the manager responsible for the policy to attend the meeting and present the updated policy to seek input and feedback from the council before they implement the updated policy in the home. The manager does not want to consult your family council on the policies and procedures of the home. So is it fact that they don't need to consult with the family council, or is it fiction that they should be consulting the family council? So this would be scenario number 8. Is it fact they don't need to consult with the family council on the policy and procedures of the home, or fiction? So this one's definitely a tricky scenario. I'm seeing some responses continuing to come in. So right now we have 33% people saying that it's fact and 67% of people saying it's fiction. Oh. So if you said fiction, you are correct. So one of the powers of a family council is to provide input on policies and procedures in the home. The legislation encourages home leadership to consult family members, residents, and stakeholders, specifically when it comes to quality improvement or the mission statement of the home are 2 examples of policies. But again, if there is a new policy and the council has requested the opportunity to consult or provide feedback, then it is something that is appropriate for them to do and to ask of the home. Your home has recently had an inspection from the Ministry of Long-Term Care. So this is scenario number 9. Members of the council are debating if you as the chair should receive a copy of the report to review during your next meeting. Is it fact that you should receive a copy of the report from the inspection, or is it fiction that you as the chair should not receive a copy of the report? This would be scenario number 9, fact or fiction? You're answering scenario number 9. Is it fact that you should receive a copy of the report from an inspection as the chair of the family council, or fiction? So I'm overwhelmingly seeing a response to fact. 100% of you are saying that it is fact. Yes, absolutely. So that is something that is within the powers of a family council. So when it comes to inspection, so if you're aware that the home has had an inspection and that the report is due, many times what will happen is a copy of the report will be given to the home administrator, but also in an envelope. And then there's another envelope that is meant to be delivered to the family council chair and the resident council chair. So you are eligible to get a copy. If you're having conversations with the administrator about the inspection and subsequent steps, you can have discussions about how you, if you are the chair, would like to receive a copy of it. But yes, you are eligible to receive a copy of the inspection result. Scenario number 10. Many residents in your long-term care home do not have family or friends involved in their lives. They have no cognitive impairments and play an active role in all care decisions. They have asked to attend family council meetings and would like to have a vote in council elections. And when councils are making important decisions, specifically the family council. Are residents eligible for membership in a family council? Is it fact that a resident is eligible for membership in a family council, or fiction? So I'm seeing about 88% of you are saying that it is fiction, that family councils or a resident is not eligible for membership in a family council. And you're correct, it is fiction. Residents can attend council meetings. However, their voice and vote is best suited to the work of a residents council. And if you look at membership, it doesn't state that a resident is eligible for membership when it comes to the section of eligibility in the Fixing Long-Term Care Act. So again, they can participate. Maybe they can share updates about what's being discussed in residence council, but when it comes to having a vote and having their voice be part of the family councils, their voice should belong to residence council, and their vote should go towards what our residence councils are speaking about, as opposed to what family councils are speaking about. Scenario number 11. The family council recently reactivated in your home community. Unfortunately, there's been a big transition in staffing with the arrival of a new administrator, council assistant, and influx of new council members with limited knowledge of how things worked when there was an active council. There's ongoing debate about the extent of detail needed to be included in meeting minutes. Some members want to include the full names of those participating in the meeting, while you're uncomfortable with posting this information publicly. You don't think that council meetings need to include full names of those in attendance. So is it fact that you don't need to include the full names of people who attend council meetings in your minutes, or is it fiction? And you do need to include full names of people who attend meetings. Just giving everyone time to answer. So far, most of you are saying that it's fact, with a few saying it's fiction. So about 62% of you think it's fact, and about 38% of you think the answer is fiction. In this case, the answer is fact. You do not need to include full names of those who attend council meetings in the minutes. You need to list the full names of guests in a specific, especially if there's a specific manager who's been invited to present. It is best practice simply to list the number of people who attend the meeting in minutes. So you'd say like 8 people attended the meeting. And again, this is mostly because of confidentiality. So even though you do have some protection in the sense that, you can't be penalized for participating or what is said during a council meeting, there's still a little bit of hesitation to participate. And so you don't need to list the full names of people who are attending your family council. If that makes them feel more comfortable in attending a meeting and openly sharing what their experiences are. And best practice is just to list the number of people who attend the council meeting, so you know how many people were part of the discussion. And then some people might choose to include initials, but again, you don't need to. Best practice is just list the number of people who attend. You do not need to list specific full names of council members who are attending meetings. You do need to list the full names of people who are invited to present who are in attendance. And again, that's just to document that they were invited and to show that they did attend and present at your council. Scenario number 12. Your loved one just moved into a newly opened long-term care home. Prior to the move-in day, you came across the Family Council Ontario website. As you get to know other families and friends of residents, you discuss the idea of forming a family council. You've sent a written request to the administrator indicating the need for support connecting with families and friends of all residents to hold an information session next month. It's been 14 days and you haven't heard a response from the administrator. Should you have already heard from them? So is it fact you should have already heard from them, or is it fiction? You should not have already heard from them. Give you a couple more minutes. This one's a tricky one. So right now, 78% of you think it's fact, you should have heard from them, and 22% say it's fiction, you should not have heard from them. So the important thing to be aware of when I'm going to answer this one is that in this case, you are indicating to the administrator that you want to create or form a new family council. So yes, if the family council existed, you would have wanted to hear back from them because it's been 14 days and you should hear from them in 10 days if you have a council that's already up and running in the home. But in this case, it's about starting a family council. So it's fiction. You should not have already heard from them in forming the council. As you indicated, this is something that you want to do and you want to establish, but they have up to 30 days to respond to the person who has indicated they want to start a council. So they have a little bit more time. And that's probably just because it's a new home with lots of new staff, lots of new residents and policies and procedures. So they have a lot going on. And so they might need a little bit more time just to process information, look at who could be best assigned to the role of council assistant to support the family council and getting things up and going, or even just to complete some education if they're new to the long-term care sector and have never heard about a family council before. They might want to come to FCO, do a little bit of research, get some support and get some training before they would get a council up and going because they want to get things started right. That one's a tricky scenario. Normally, if it's just council business, yes, you should hear back in 10 days. But in this case, because it is a new council, so there's no existing active council, it's a new home, you're indicated to the administrator you want to start a council, they have 30 days to respond to you once you indicate that you want to start a family council. So this is the last scenario, and then I'll get to your questions. So your council is blessed with an extremely supportive council assistant. The home's undergoing restructuring with changes in staffing and roles and responsibilities. The administrator has shared with the council that the current council assistant will need to be replaced as they're being reassigned. After sharing the news with you in your meeting, the council has agreed that the administrator cannot replace your council assistant without consulting your group. So is it fact that they cannot replace, or is it fiction that the administrator can do what they want? So is it fact that the administrator cannot replace your council assistant, or is it fiction and they can replace your council assistant? Seeing the answer slowly coming in, but very good response. Thank you so much for your participation in this session. It's hard to make policy exciting for people who are not a policy person, but I thought this would be a good way to kind of test your knowledge. It seems like it's come through because with this answer, so 56% of you say it's fact that they cannot replace, and 44% of you say it's fiction. The answer in this scenario is fact. Replacing a council assistant with someone that is not agreed upon by the council is considered interference. The administrator cannot make any decision on behalf of the council, which includes how you choose to connect with each other, as well as with who you have supporting you and your council. So again, the council assistant is someone that is appointed and that the council agrees is someone that they can work with when it comes to the work of their council. So again, realizing that this is a lot of information, and if this information is new to you or if you want to revisit something, that's what the Family Council Ontario team is here for. So if you do have any specific questions, please feel free to reach out to anyone on our Family Councils Ontario team. If it's policy related specifically, I'd say Tiffany Fioran, who is our policy and research manager, is a great person to connect with. If you would prefer to have your support in either French or English, then you can connect with our client services manager, Leanne Pellissier, or our bilingual outreach manager, Natasha Dupuy. If it's communications related and you want to know more about some of the information you came across, connect with Leah, who's our communications manager. If you come across a link that's not working on our website, please let us know. If it's anything else related to overall Family Councils Ontario, then you're going to want to connect with Samantha Peck, who you know has been leading us through today. And then, of course, you can connect with me if you have any questions specifically connected to the session that I did today. So I'm going to stop my sharing, and I'm going to look at your questions that you have now. Alrighty. Yeah, let's see what the questions are. Oh, okay. This question, Chilette. Is it within the Family Council Assistant's responsibility to impart knowledge regarding advocacy strategies to Family Council members they may not be aware of? Should the licensee hinder the assistant in any way from sharing information? Well, if it's meant to support the council in the sense of being able to act within their powers, and it's something that the council has requested the assistant to kind of support them in figuring out how can we learn more about advocacy, or who would we talk to? So if it's something that the council specifically requested them to help support them in doing, or to learn about advocacy or how to talk about something, then I don't see that being a huge issue, because again, they take their direction from the council. So if the council's asking them to find information, um, when it comes to advocacy, or maybe to find a speaker who could come in and speak about best practices for advocacy within their own council, then that if the administrator is preventing the council from learning a little bit more about how they can engage in advocacy, that would be considered interference, because they cannot tell the council what they can focus on in their discussion. I'll look to Sam or Tiffany for any specific guidance on that one. That one's a little bit of a tricky one. I see Sam's coming in. Great.
So I'd agree with Kathleen. I don't see that it's not a specific conflict. I think sometimes home leaders can be apprehensive about giving councils more support about how to advocate. But I think our speakers earlier today really emphasized that knowledge is power, and part of that knowledge building is expectation setting. So I'd say with supporting advocacy is also to support knowledge building. It's a great question. Kat, we have time for one last question. So which one do you want to cover?
I'm trying to look at all of them. I think this is an interesting one. So in Ontario, can a counselor who is not assigned as a board member of the long-term care home be a member of the family council when they're a caregiver of the resident? So I'm guessing, is that like a municipal, like city councilor? I don't know enough of a context to that to know what their role would be in terms of the organization governing the long-term care home to be able to answer that. If it's a municipal home and they're a counselor and they know nothing, like that's not in their portfolio, then
maybe. So yeah, the long-term care, Fixing Long-Term Care Act. So it says that people, so for who cannot be a member, an officer or director of the licensee of the corporation that manages the home. So if the municipality is the licensee, then that would be a conflict. But if it's someone who has no oversight for the long-term care home, that would likely, so this isn't legal advice, be acceptable. So, Kat, that'd be my answer for that.
what I will do, we get a log of all the questions. I will look at this, and based on the questions we have, I'll work with Tiffany to figure out some type of resource, fact or fiction, that we can do based on the questions that you shared. I'm so sorry that we ran out of time. As I said, there's a lot of information to go through, and I really wanted to make it fun and interactive. So we will take these questions. I'll work with Tiffany to create some type of resource to answer them. And thank you so much for taking the time to sit through a policy-based session at the end of the day.
Thanks so much, Kathleen. There's great thoughts in the chat around how helpful this was. So absolutely. And scenario-based learning really does bring it home for us. So yes, these slides will be shared. We're going to be looking at any questions we didn't get to do some follow-up. And of course, feel free to connect with us offline. We're always here to help. We're going to be going into closing remarks now. Hard to believe that we've spent our time together. So we are going to go to the closing remarks session. And remember, if you want to win our second door prize, you need to be there to attend. So give us 30 seconds or so as we transition to our closing remarks, and where we'll recap, talk about next steps, and draw for our second prize. See you there in just a moment.